The theme for today's episode is Andres, drum roll, please. Surprise! There is no theme for today's episode. Today's episode is going to be called Miscellaneous Medical Maladies. We have a hodgepodge of viewer questions that we just haven't been able to get to up until now. So we're going to answer those questions and more here on this episode of Ask the Doc.
Send in your questions to questions@allhealthtv.com or AllHealthGo on Facebook or YouTube, or visit the Ask the Doc page on our website, allhealthtv.com.
Welcome to Ask the Doc, the show where we encourage you, our viewers, to send in your healthcare related questions and we answer them. I'm Dr. Kamaljit Kaur, a board certified primary care physician here in Coral Springs, Florida. And today's first question comes to us from Danny, and Danny reached out to us through our Facebook page. So let's see what Danny has to ask. Hi, Dr. Kaur. I've never heard of it until I was diagnosed with this barely pronounceable skin condition, lichen sclerosis. What is it and how do you cure it? Hi, Danny. Thank you for sending in your question. Let's talk a little bit about lichen sclerosis. Now, this is an inflammatory, chronic, usually, skin condition that can present with patches or plaques in various parts of the body. Now, more commonly, we do see this condition in the genital region of women, but it can present in other areas of the body. And as you're seeing in the video here, patches are very common, and that can progress into what we call plaques. Now, these can be darker than your surrounding skin, or they can actually even be lighter than your surrounding skin. And like I said, it's most commonly seen in women, but we see it in both genders. Now, what causes it? Well, we know that it's an inflammatory condition, but we don't know what exactly causes it. Research has pointed to a few factors that can explain its origins. Now, this can be due to an overreaction of your autoimmune system. It can be due to genetic risk factors that you may have. And believe it or not, it can be due to an infection that you had in the past or trauma that skin sustained in the past. And then lastly, but definitely not leastly, it can also be due to hormonal changes. Now, we have seen this very commonly occur in women when they are going through hormonal changes in their later life, specifically when the estrogen levels start to drop. Now, these plaques can range from being completely asymptomatic, where you don't have any symptoms, you just see maybe an unsightly rash, or they can be very symptomatic, where you're having constant itching, burning, sometimes even cracking of the skin. And then that can even lead to bleeding of the skin and what we call fissures of the skin. Now, depending on how severe your symptoms are, your doctor will make certain recommendations to treat your lichen sclerosis. So it depends on where on the body it is, right? Now, studies have shown that the more symptomatic you are, it's kind of odd to say and to know, but the more symptomatic you are, that means the more active your lesion is. And the more active your lesion is, the more likely that it's going to respond to the medications that we prescribe. And the better chances that it's actually going to work. Now, inactive lesions, for some reason, again, something we haven't quite figured out yet, but research has shown that inactive and asymptomatic lesions don't generally respond to the treatments that we prescribe as well as the active ones do. So what do you treat it with when you do need treatment? If you have a small area, maybe just a little bit on your wrist or under your underarm, then your doctor might prescribe a topical steroid for it. Most of us are familiar with hydrocortisone, topical corticosteroid cream that's available over the counter, but you might need something a little stronger and your doctor may give you a prescription steroid cream or ointment. Now, if this doesn't work, or if you have large patches or patches in multiple areas of your body, then we got to up the ante and maybe include phototherapy into your treatment. And phototherapy is basically a method in which UVB and UVA light, wavelengths are used to treat that part of the skin. And they do this through a variety of mechanisms, but primarily they do this by inducing an anti-inflammatory and calming effect to that area of the skin, and then it can start to heal. Now, if the topical steroids don't work, if the phototherapy doesn't work, then Then what do you do after that? Well, you can also do some oral treatments. Now, some of us have heard of methotrexate. It's a very commonly prescribed medication in certain autoimmune conditions, and it is a pretty big gun medication, so we don't prescribe it lightly. But it is available if you need it for treatment, and you and your doctor can sit down and discuss how bad your lesions are, where on the body they are, if you've tried other mechanisms or other methods to treat them, and if you're somebody who would benefit from the methotrexate. Now, remember, anytime you take any kind of a medication, you also want to discuss with your doctor what are the pros and cons of taking this? What are the benefits of taking it? And then what are the risks of taking it? Because all medications do have risks, even if they're minimal. So you don't want to inadvertently treat one thing, but then mess up something else on the side, at the same time. So always sit down and talk to your doctor about the treatment options for any condition, really, and see what is best for you. I hope this helped answer your question, Danny, and I hope you feel better soon. All right. So the next one is, this comes to us from YouTube, and this comes to us from Griffin. His question is, hey doc, I haven't been feeling well lately with symptoms that come and go, like lower abdominal pain, nausea, fever, and inability to flatulate. So I went online to self-diagnose, and this is what I came up with: chronic appendicitis. Have you heard of it, and what do you think? Hi, Griffin. I'm going to thank you for your question very much. And of course, we've heard of chronic appendicitis, but I wouldn't be surprised if many of you haven't heard of chronic appendicitis. Now, appendicitis, we've all heard of that, and we know what can happen with appendicitis. But did you know, just like Griffin said, it can be chronic as well as just acute, which means happening at that very moment. Now, excuse me, unfortunately, the only way to properly diagnose appendicitis as chronic is to look at it under a microscope. And the only way to do that is when the appendix is taken out. So generally, the findings that doctors and pathologists see under the microscope can let us know that, this person's appendicitis was actually chronic. Either way, that brings me to a very important point. There's certain symptoms that raise suspicion for appendicitis in general and inflammation of the appendix. That's what appendicitis is. So let's go through them. Now, some symptoms of chronic appendicitis include, number one, pain in the lower right belly or near the navel, or better known as the belly button. Number two, loss of appetite. It's very common that you're not going to want to eat anything if you're having any kind of abdominal discomfort, right? Number three, nausea and vomiting soon after the belly pain begins. Now, we see this very commonly after the appendix becomes very inflamed, it causes the pain, and then, of course, the other common symptoms of nausea and vomiting come on. Number four, you can get a swollen belly. So that happens because the inflammation is causing maybe some gas buildup or for the other organs to enlarge in the abdomen, and then that can cause a swollen belly. Now, number five is a very, very common one that we see with appendicitis, and it's important too. Fever of 99 to 102 degrees Fahrenheit. Now, fever is your body's way of fighting. A fever is basically your immune system saying, hey, there's something in here that shouldn't be in here, so let's fight. And that's basically what a fever is. So a fever is a good sign, but it also is a sign of something going on in the body, some kind of inflammation that's become excessive. The other one I wanted to let you know about is number six, the inability to pass gas. This can happen for a variety of reasons, not only in appendicitis, but in many abdominal diseases that become complicated. So if you see number six and you're not able to pass gas, or you're not able to have a bowel movement, either one of those are very, very emergent signs. And if you're experiencing them, we do recommend that you seek medical attention almost immediately. Now, if you're experiencing these, like I said, please do seek medical attention because you don't want it to get worse and you don't want it to become, unfortunately, a life-threatening situation. So the sooner you get it taken care of, the sooner you can get back to being healthy. All right, well, we've got our first question from allhealthtv.com, and that is our website, which we love and we hope you love too. There's a lot of great information on there. So when you have some downtime during your day, go ahead and peruse it and hopefully you'll learn something. All right, this one comes to us from Annie, and Annie asks, Dr. Kaur, my husband Mayer was a smoker for a number of years before I got him to quit. He's had a little trouble breathing lately, so we went to our PCP, who thinks Mayer may have chronic obstructive pulmonary disease, or better known as COPD, and wants us to see a pulmonologist. I just read that there are various stages of COPD. Could you tell us what they are? Hi, Annie. I'm so sorry that your husband is going through this. I'm so proud that he's been able to quit smoking because that is a great accomplishment. I know sometimes people who smoke carry a lot of guilt over the fact that they smoke, and then also over the fact that they may not be able to quit easily. And I don't want anybody to feel that way because we in the medical professions know that quitting smoking is very, very difficult. It is, after all, a habit. And the longer that you've been doing it, the harder it is to quit. So we welcome you to come in to talk to us and let us know that your goal is to quit smoking. And we would be so happy to help you do it safely and healthily. Now, back to Annie's question. So let's talk a little bit about COPD. Now, did you know that 10% of people over the age of 40 have COPD, and that COPD is consistently ranked as one of the top reasons for death in the United States? I don't want to scare anybody, but those are pretty scaring statistics, are they not? Now, COPD, a lot of us know that it's a respiratory condition, but let's go through it a little bit more in detail. Now, as with many other respiratory conditions, COPD includes symptoms like difficulty breathing, a lot of coughing, maybe even constant coughing, and then bringing up sputum with that cough. Now, sputum, I know it might be a medical term, and maybe many of you are not familiar with it. Sputum is not just saliva that's produced in your mouth, because sometimes when you cough, maybe you'll cough out some saliva that was already present in the mouth. But sputum is the mucus that comes from the lungs. It gets expectorated out when you're having a really forceful cough. And honestly, sometimes it comes out like a big goop of glob, for lack of better word. Now, in the old days, we used to think that if that sputum that's coming out is green, then there's an infection and we need to get you on antibiotics. But more recent studies have shown it doesn't matter what the color is. What matters is what are the other symptoms that you're having and what is the intensity of the cough that you're having. Now, back to the fact that COPD does share a lot of common symptoms with other health conditions, other respiratory conditions like chronic bronchitis or asthma. The one thing that differentiates COPD from those is that in COPD, an individual will have a markedly reduced lung capacity. So their ability to breathe, even during normal situations, may be reduced from what their baseline used to be before they got COPD, or reduced compared to somebody who doesn't have COPD. Now, long-standing smoking is a risk factor for COPD. So like I said, I'm so glad that you quit smoking, and it does contribute the more you smoke. So you want to make sure that you're mindful of that. Now, because of this, it's also very, very important to note that COPD can progress into different stages and become life-threatening. So it's really important to recognize it and to treat it early. So let's go through some of these stages that we keep talking about. Now we have the first stage, which is generally pretty mild. And you may have some difficulty breathing, but it's not significantly limiting your day-to-day activities. The second stage is a little bit more moderate. Now, this is where you may have coughing, you may even experience some wheezing, and you may experience shortness of breath. Now, that shortness of breath may be while you're at rest or when you're walking, but either way, you're having some difficulty breathing doing your day-to-day activities. Now, the next stage is more severe. And this is when airflow to the lungs is really limited and your capacities are really restricted. You've probably also spent some time in the hospital if you have severe COPD. And this is generally due to the fact that you're prone to repeated exacerbations of the condition. Now, the last stage I want to point out is very, very severe. Now, in this stage, it is very difficult to breathe, even when you're just at rest and you're not doing much. And that's because your lung capacities are very, very reduced. Now, you may also be on supplemental oxygen as somebody who has the last stage of COPD. This is also known as end stage COPD, and you will likely require supplemental oxygen. For those of you who don't know what supplemental oxygen is, it's when individuals need extra oxygen, and they usually have it through a tube that's connected to a canister of oxygen, and that supplements their breathing. Now, it's also important to know what your actual lung capacity is, because that is what puts you into the defined stages that we use to treat you. Now, somebody at the very early stage may not need as extensive treatment as somebody who's at end stage. So the best way to figure this out is through a variety of breathing tests that I'm sure you can do at the pulmonologist's office. And actually, some primary care offices have these tests as well. Now, Annie, I hope Mayor sees the pulmonologist as soon as possible so that he can get appropriately diagnosed and, more importantly, treated so that he can live a happy, long, and healthy life, and that you two can enjoy being healthy together. Now, in case you missed it the first time, here's how you can send us your questions.
Send in your questions to questions@allhealthtv.com or AllHealthGo on Facebook or YouTube, or visit the Ask the Doc page on our website, allhealthtv.com.
Now, our next question comes to us from Ivania. Pretty name. Ivania asks, hello, doctor. My eldest daughter, Manessa, another pretty name, just went on birth control a few months ago and started developing hardcore migraines soon after. I've been doing some research and just read about hormonal headaches. Could there be a correlation between the birth control pills and my daughter's headaches? And if so, what can we do? It's an excellent question, Ivania. Thank you for sending it in. So there's so many considerations when you start birth control pills. And I know that not all the time people or patients understand this, but believe me, when you go to any doctor to get a prescription for birth control pills, no matter what age you are, there's a series of questions that are going through our mind that we may or may not even let you be aware of before we even start to write that prescription. So especially when it comes to headaches, we want to know what type of headaches is she having? Because if these are true migraine headaches, and then especially if they're headaches with aura, we have to be very, very careful as to what we prescribe, because sometimes certain oral contraceptives in individuals who have migraines with aura, can actually increase risk of stroke. And that is definitely not something that we're trying to do. So that's one of the things that we really have to be mindful of. And then these headaches, how often is she getting them? Because if they're frequent or they're really intense, then it may even warrant changing of her prescription of her oral contraceptives. And then what is her blood pressure? There are certain moments in which oral contraceptives can change blood pressure, can increase blood pressure. And if that's the case, then we have to be very, very mindful, because one, we don't want to increase anybody's blood pressure, right? That's dangerous all on its own. But also, can we prescribe another medication or another contraceptive that would be more beneficial and not as high risk of complications in this patient? And then the other thing that we always want to be mindful of is there something going on in the brain or the skull? Is this an individual who has, God forbid, a tumor or something that causes increased pressures in the skull, between the skull and the brain? Because if that's the case, then oral contraceptives, some of them can actually worsen that too. So now, depending on the answers to these questions, her doctor and her will sit down and decide what is the most appropriate route to go for oral contraceptives, which ones are the best for her, which ones are still going to be effective and not going to have as many side effects, so that she can take them safely. All right, friends. Wow, another question from YouTube. And this one comes to us from Patrick. Patrick wants to know, Dr. Kaur, I always forget to ask the doctor this question when I go in for a checkup. But since my mom loves your show and watching it right now, I figured I'd ask you, why do doctors push on your stomach and measure it when you go in for a checkup? Patrick, you're hilarious. Thank you so much for your question. And please thank your mom for me too. Hi, Mom. Now, when you go into your doctor's office, there's a series of things we do, right? We check your blood pressure, we check your height, your weight, your temperature, how fast your heart is beating, how fast you're breathing. There's a method for all the madness. Now, when you go in and you have all your vitals done, your doctor will talk to you and have a conversation with you, right, about your symptoms, your general health, how are you doing, how can we keep you healthy? And then we proceed to do what we call the physical examination. And during the physical examination, we will assess certain parts of your body to see if things are normal, essentially. Now, when we're pressing down and feeling around your stomach, we're really doing this so that we can feel the different organs that are there, to see if they are at the right size, that nothing is swollen, that there's nothing out of place, for instance, which does happen sometimes. And there's a certain way that things should look, should feel, and believe it or not, should sound as well to us, for us to know that everything is essentially normal and everything is working the way it should be. Now, well, by pushing around and pressing deeply sometimes on certain parts like the liver, we're able to determine if that organ is enlarged or if it's shifted. And if that's the case, then that alerts us to, hey, there may be something going on in this person's body that's not supposed to be going on. And then that's when we would further investigate with maybe doing an ultrasound or other imaging or even blood tests. So I hope that answered your question. All right, it looks like we're veering a little away from YouTube and we're going towards Facebook. And this question comes to us from Ethel, and Ethel asks, Dr. Kaur, this is kind of embarrassing, but I think I have psoriasis. My scalp and the back of my neck have been awfully itchy and I just can't stop scratching. I feel like I'm starring in a old Head and Shoulders commercial. What can I do, doctor? Hi, Ethel. I'm so sorry that you're experiencing this. I know it's so uncomfortable. And I have some ideas to share, but before I do, let's watch this video from our friends at the Mayo Clinic.
Everyone has experienced an itchy scalp at times. Mayo Clinic's Dr. Dawn Davis says it's different for those with psoriasis.
So oftentimes patients will have scale on their skin, on their scalp, that itches or kind of stings when they go to shampoo their scalp, and they just assume that it's really bad dandruff.
She says psoriasis is thought to be an immune system issue that results in faster than normal growth of skin cells.
Typically, skin will grow and shed in 28 to 30-day cycles, but psoriasis skin grows and tries to shed in a 72-hour cycle. So it's almost growing 10 times the speed of normal skin.
There is no cure for psoriasis, but there are treatments.
Treatments we use for psoriasis help decrease the inflammation in the skin and turn off that cell cascade of the immune system, and also slow the skin growth to something that approaches normal.
Dr. Davis says maintaining a healthy weight and avoiding tobacco and excess alcohol can help to decrease the severity of psoriasis. For the Mayo Clinic News Network, I'm Dee Dee Stephen.
So just like Dr. Davis was explaining, psoriasis is an inflammatory autoimmune condition, and there's different ways to treat it. Now, how we treat it also depends on where on the body it is, just like lichen sclerosis. If you have psoriasis plaques that are on the scalp or another area that's kind of difficult to reach, then our treatments also change according to that. Now, generally, the first line treatment for psoriasis in general of any kind is topical steroids because they help to reduce the inflammation and calm down the skin. Now, if you think about it, if we give you a topical steroid, whether it's a cream or an ointment, it's kind of difficult to get through all the hair, right? So sometimes we'll prescribe a shampoo, or sometimes if the psoriasis is bad enough, even an oral medication can be prescribed. Now there's different intensities of medications and different modes of medications. Is it a cream, an ointment, and a shampoo, or is it oral that your doctor may start you on? But the first thing to do is get it thoroughly evaluated by your physician. Now, this could be your primary care physician, or this could be your dermatologist, in order to see what stage is it at, what body location is it on, and what's the best way to treat it. The other thing, I don't want you to be embarrassed, unfortunately or fortunately, it's a very common skin condition. And I say fortunately because the more common it is, the more treatments that we have for it, the more research that's going into it. So even though there's no actual cure for it, there's ways that you can treat it with medications. And let's not forget your diet. What you eat matters. There are certain foods that are inflammatory, like processed foods, deli meats, that can actually increase the inflammation in your body and maybe even promote the psoriasis plaques to form. So you want to be mindful of what you're eating too. Just eat a nice, healthy diet, and that should definitely help. All right, folks, we got back-to-back questions, and this one comes from Esther. And Esther asked, Doctor, my friend Ginny has been bleeding for about 6 days now, and my girl is 2 months pregnant. There's no way this is normal, right? I told her she can go to her OB I told her to go to her OB as soon as she can, excuse me. So you're very much right, Esther. I do believe that your friend Ginny should go to her OB as soon as she can. Now, bleeding early in the pregnancy may be normal. Any kind of bleeding in any stage of your pregnancy, you want to talk to your doctor about it because you want to make sure excuse me, that it's not a sign of an underlying health condition and that mom and baby are safe, baby is developing safely, and the pregnancy is proceeding uncomplicated. We would never want anything to happen just because we didn't seek care, right? So please, please, I'm so glad that you're there for your friend. Do encourage her to go see her doctor and get it figured out as soon as possible. Now, if you've got questions, we've got answers. Just in case you missed it the first time, here's how you can send us those questions.
Send in your questions to questions@allhealthtv.com or AllHealthGo on Facebook or YouTube, or visit the Ask the Doc page on our website, allhealthtv.com.
All right, friends. So I think we have time for one more question, and this comes to us from Ahuva on Instagram. Now, Ahuva, I'm going to summarize here, is asking about allergies. Now, allergies to food or things in the environment are very, very common. You want to recognize the symptoms and you want to get treatment as soon as you can. There's various ways to treat it, but you want to recognize it first so you can do that. Unfortunately, guys, that's all the time that we have for today. I hope that all the questions that we answered, even though it was kind of a mishmash of questions and there wasn't a theme today, helped you with your healthcare concerns. Now, you can always send us some more questions and we'd be very happy to answer those. I hope you guys had a good time as I did, and we'll look forward to seeing you next time here on Ask the Doc.
Send in your questions to questions@allhealthtv.com or AllHealthGo on Facebook or YouTube, or visit the Ask the Doc page on our website, allhealthtv.com.